Hi guys! Welcome to another video. It's me, Charlotte Mipunla, Bachelor of Elementary Education at Bataan Peninsula State University, Dinalupihan Campus. This video, I'll be showing you about socio-emotional disorders and chronic illness, and the type of disability and what people can do to support learners under this category. So without further ado, let's get started! Socio-emotional disorder includes illness or disease that affects a student's thought processes, perception of reality, or judgment, which result in disturbed behavior. This disability may be temporary or permanent. Unemotional disorders affect a person's ability to be happy, control their emotion, and pay attention in school. These disorders affect the whole child feelings, behaviors, social development, and cognitive functioning. According to Gallaudet University, symptoms might include inappropriate actions or emotions under normal circumstances, learning difficulties that are not caused by another health factor, difficulty with interpersonal relationships, including relationships with teachers, peers, a general feeling of fear and anxiety related to personal or school matters. Next is we have types of socio-emotional disorders: the depression, anxiety attack, emotional behavioral disorder, obsessive-compulsive disorder, and bipolar disorder. First is depression. We know that this type of SED has many experience during pandemic until now. Depression is an illness characterized by persistent sadness and loss of interest in activities that you normally enjoy, accompanied by an inability to carry out daily activities for at least 2 weeks. However, when these feelings persist and keep the child from going about his or her regular day, clinical depressions may be the cause of the moodiness. To support the student who experience this type of socio-emotional disorders, talk to the students in private, listen carefully and validate the student feelings and experiences, and be supportive and express our concern about the situations. Next is obsessive-compulsive disorders. Is a disorder in which people have recurring unwanted thoughts, ideas, or sensations that make feel driven to do something repeatedly. So to support or to help the learners who experience this we should talk privately with the students in a supportive way. Have students work with the peer to complete specific tasks and give extra help to get work completed. Talk with the student parent to learn more about the students and share what you've noticed. So the third one is bipolar disorder. It's a mental illness that causes unusual shifts in a person's mood, energy, activity levels, and concentration. These shifts can make it difficult to carry out day-to-day tasks. So there are some symptoms of bipolar disorder: the serious mood swings that differ from their usual mood swings, being very hyperactive, impulsive, and aggressive, which affects how a child acts socially and in other areas of life, raising thoughts sometimes shown by quickly and often changing subjects when talking. So to support the learners who experience this is understand triggers and learn strategies for managing intense emotions and irritability. Remember that treatment takes time. Sticking with that treatment plan can help your children get better and stay better. So we are done to socio-emotional disorders and its type. Hope you learned something, so move to the next topic, the chronic illness. Chronic illness is a disease that persists over a long period of time. Chronic disease can hinder independence and the health of people with disabilities, as it may create additional activity limitations. Is a disease or condition that usually lasts for 3 months or longer and may get worse over time. Chronic diseases tend to occur in older adults and can usually be controlled but not cured. The most common types of chronic illness are arthritis, cancer, stroke, heart attack, and obesity. So next, I will give an information of types of chronic illness. First is arthritis. It means inflammation or swelling of one or more joints. It describes more than 100 conditions that affect the joints, tissues around the joint, and other connective tissues. Most forms of arthritis are thought to be caused by a fault in the immune system that causes the body to attack its own tissues in the joints. This may be inherited genetically. Second is cancer. It's a disease caused when cells divide uncontrollably and spread into surrounding tissue. Most cancer-causing DNA changes occur in sections of DNA called genes. This can develop at any age, but as we get older, most types of cancer become more common. This is because our cells can get damaged over time. So next is stroke, sometimes called a brain attack. Occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. In other cases, parts of the brain become damaged or die. Next is heart attack. Happen when a part of the heart muscle doesn't get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. The cause of heart attack sometimes plaque deposits inside the coronary or the heart arteries can break open or rupture, and blood clot can get stuck where the rupture happened. If the clot blocks the artery, this can deprive the heart muscle of blood and cause a heart attack. The last one is obesity. Obesity defined as a abnormal or excessive fat accumulation that presents a risk to health. A body mass index or BMI over 25 is considered overweight and over 30 is obese. Obesity is generally caused by eating too much and moving too little. If you consume high amounts of energy, particularly fat and sugars, but don't burn up the energy through the exercise and physical activity, much of the surplus energy will be stored by the body as fat. So this where our video ends. Hope you like it and learn something. Again, I'm Charlotte May Punla, and please like and subscribe. Bye!